can actually see each other this week. So what I'm gonna go over this week is we are gonna go over a couple different types of trauma dressing. So we are going to go over pressure wrappings and pressure bandages, just how to make them really fast and easy. This would be what to do when you have a major bleeding that for the most part is controlled or completely controlled, or how you would wrap a major injury site and major bleeding that is being controlled by a tourniquet. So now you're just wrapping up the wound site to make sure that there's extra level of security. I'm gonna go over occlusive dressing, so when you need a dressing to be watertight and airtight. Specifically in this case, what to do if there's a sucking chest wound and you need to control external airflow into the body. And then we're also going to go over major trauma dressings for eviscerations, our favorite, which is when an internal organ is now external. So we're gonna go over those three things. So to start off, oh, and before I go on, I want to preface this with, most of this stuff is with super basic first aid supplies or things that you can find around the house. I'm using a lot more medical supplies this week, just to kind of help out and give you an idea of how we would do it in a professional setting, semi-professional setting, because I'm still at home. But any of these things can be substituted out for household items. So, you know, if you don't have gauze, towels, socks, clothing, scarves, anything that is absorbent, if you are looking for any sort of like occlusive dressing, anything that's plastic works. You'll be seeing that a little bit later on. I'll be showing that off. And then, you know, ACE wraps, once again, any long fabric item. Think of back to the tourniquet video where you can use basically anything. So we're gonna start off with a pressure bandage. So I got a big old cut on my arm. That's never coming off of my arm now because that is definitely Sharpie. So yeah, you're at home, and once again that pesky roommate is using heavy machinery out in the backyard, and a piece breaks off and it flies over and it cuts their arm. It's pretty deep, but it's not in a super major spot, so the bleeding's heavy, but you can control it without a tourniquet. If we had done a tourniquet, we'd be running out of room a little bit, so luckily this is controllable. So what we're gonna start with is you're gonna take gauze. I keep a bunch of these little like 4x4 and 2x4 squares just in a bag. Keep them in your car, keep them in your purse, keep them on you at all times. They're really handy for everything. Once again, you wouldn't need to use those. Towels work great. I would avoid paper towels and toilet paper and tissues because there's a good chance that those will kind of break down and flake off into the wound, so fabric items. Obviously you want to be as sterile as possible, but in the situation where someone's bleeding really heavily, every second counts, and if you don't have a bunch of sterile gauze or, for the most part, fairly clean gauze around your house, you know, better to stop the bleeding and worry about infection later than feel like, oh no, wait, let me wash this really fast. So I'm gonna take the gauze, I'm gonna just start kind of balling it up and I'm gonna cram it in. It's gonna be really gross, but it's gonna give you the best chances at stopping the bleeding. So we call this packing the wound. You're gonna pack the wound, you're gonna shove all this gauze in there, and then you're gonna start holding down pressure. And while you're in there, feel around, see if you can feel where the bleeding's coming from, where the nick is, and then try and jam it up right up next to it, which is a really attractive way of describing it. So you're gonna go, you crammed it in there, you're now holding pressure. By shoving all this gauze up, you're giving like a hard, compact item to hold pressure internally. If you were just holding on the outside, that whole area is still getting blood flow, and because it's injured, holding pressure isn't as effective as it would, you know, just on your normal arm. So by putting this inside, you're clogging it and you're giving something hard for you to press on. So cram that in the wound, great. It's slowing down the bleeding, which is exactly what we want. I know the fun part of trying to do this on my own arm because I am home alone, as everyone else is. Normally you would not be doing this by yourself, and at the very least you would have two hands. Although, you know, this happens to you. If you're that pesky roommate using heavy machinery, demonstration. So you're gonna get that up on your arm, that's crammed in there. And now I'm just gonna start taking gauze squares and I'm just gonna start holding it on top. So stacking them up on the outside of the wound. I've assumed at this point that you've crammed the injury site as full of gauze as you can possibly get it. And so you're just gonna start packing more and more and more. Keep holding pressure. It's really important that you keep holding pressure, because the minute you let go, everything is dislodging. The blood's gonna push the gauze out. You're losing any clots that you've, put in place so far. So you're just gonna keep doing the same thing. Keep stacking gauze. Okay, so I have a good stack of gauze on there. I'm gonna say that at this point, the bleeding has slowed down significantly. It's in a spot where I feel good enough to wrap it. It's not really soaking through the gauze much. If you got to this point and you are still soaking through, you should reconsider your dressing type. So should you be using a tourniquet in this situation? It's not really slowing down, so probably. You're gonna wanna hold more pressure. I like to get people down on the ground and use my legs because they're heavy and have a lot more strength than my arms do. So get them down on the ground, get the arm in a position where you can kneel your knee and your shin down and press down with that, because you'll get a lot more force. That, or just keep stacking down and hold down for longer. You usually want to hold down for at least a minute when controlling bleeding, because it's going to take its time to stop. But we're going to say that this is good enough, so now I can start dressing it. So what I'm going to do for a pressure bandage is I'm going to just take a trusty Ace wrap. Once again, try and do this one-handed. So just a normal Ace wrap or a scarf or something, other gauze, something long and fabric and durable that will be able to hold down pressure so you can move on and deal with what other injuries this person has. So this is gonna be really unattractive for the first couple seconds. You could do a couple of things to kind of help yourself. You could try taping it, which probably would have been a good thing to try, but I'm just gonna go for the classic hold it down. So you're just gonna start wrapping, and you're gonna wanna get this as tight as possible. Obviously, if this person was actually bleeding, their gauze wouldn't be sliding around like mine is. So you're just gonna start wrapping around and around and around. Normally you want your gauze to be rolled up. In fact, I even had to refilm this video because my gauze wasn't rolled properly, or my Ace bandage wasn't rolled properly. And then the minute I put this on my arm, it fell and, unwrapped. So this is how we're doing it. But normally it's really easy if you have it in a roll and can just roll it around. So I've gotten a couple of good wraps around with kind of as tight as I can with one hand. And so now what you're gonna do is you're gonna take it and you are gonna start twisting it. So what you wanna do is you wanna put the twist in the Ace wrap directly over the wound, or as close to the top of the wound as you can do. And you're just gonna keep doing that. You're gonna bring it around, you're gonna twist, you're going to tighten it down, you're gonna bring it around, just keep doing that. You're going to twist, bring it around. So by doing that, you're creating an extra kind of solid point of pressure. So obviously the flat Ace wrap does a good job of holding things down, but you're now creating like a concentrated point where the Ace wrap is doubled up on itself and now it's stacking up more and more and more. That'll kind of hold pressure for you. And when, in a situation where this is the only major injury, it now aids you in holding down pressure. So you can do a pressure wrap and then go and put down pressure, and you know how this little nugget of Ace wrap for you to hold down. So I'm gonna just do that a couple more times. I like to do it at least 4 or 5 times. After that, you're getting a little redundant and you don't necessarily need it. So I'd say that that's good. Mine comes with Velcro, so I'm just gonna bring it around. The Velcro's on the wrong side naturally, so I'm just gonna twist it, bring it down. Can you guys see my arm turning nice and red? It's a good sign. So now you've just got this big old lump directly over the wound, and you can continue to hold pressure. And I can tell you right now, that is not comfortable, and that's a good sign. It's a sign you're doing it right. So once again, you're gonna pack the wound, you're gonna cover it with as much gauze as possible, and then you're gonna do a couple normal wraps, you're gonna twist, bring it as tight as you can, and then continue to hold pressure. You can have someone else hold pressure, you can have your partner hold pressure, you can have the person who's injured hold pressure. You can continue to hold pressure, but just that way your arms are freed up and you can go do other things if you need, and you now have something that's holding onto that wound for you. So one thing to cover really fast, I promise the other ones are going to go a lot faster than this. So say you did all of that work and you wrap it and it's still bleeding through, and maybe it's in a spot where you can't quite get a tourniquet. So maybe it's like up here on the shoulder and there's nowhere really higher that you can put a tourniquet. Don't take the bandage off. Don't be like, oh, whoops, wasn't good enough, and then yank everything off, because you're dislodging everything. Just do an additional one on top of it. So have your wrapping, stack more gauze on top of where the blood is soaking through, and then do another wrap on top of it, because you're just creating double pressure. But no matter what, you don't want to take off that bloody gauze. Okay, we're gonna have a little change of perspective here. Okay, perspective change. Woo. These are things that I definitely can't do with only one hand. So, we're gonna say that this is somebody's chest. And here's a little puncture. So, either they've been shot in the chest, or they've had some sort of sharp object penetrate them, or something. They now have a hole that's going right through into their lungs. So what's happened is it's gone all the way through, it's created a big enough hole that air can now travel in through that hole whenever you breathe in, and then whatever lung is closest to it has deflated, most likely. Usually any time that air is coming in from the outside, your lung deflates. So we need to plug this, obviously, because every time they breathe in, air is getting pulled through this hole into the cavity where the deflated lung is, and not in through their mouth and into their actual lungs, or their good lung in this case. So we need to find a way to cover this. So we call this a sucking chest wound. And I wish that I could find a better way to show you guys, but Google some pictures, they're pretty gross, but really cool. So what we're gonna do to cover this sucking chest wound is we are going to make an occlusive dressing, which means that it's airtight and watertight. So they do sell dressings specifically for sucking chest wounds, and it's like a really sticky adhesive that goes down, and then there's a little air valve on top of it, and you have to come over and like burp it every now and then, because what's gonna happen is when they breathe in, air is getting pulled in, and then when they breathe out, air is getting pushed out. So what we want to do in this dressing is we want to stop air from going in when they breathe in, but we want to give room for the air to come back out when they breathe out, because otherwise air is going to get trapped and you're going to get this thing called a pneumothorax, which is air in the thoracic cavity, and that's not good. We don't want that. That can lead to a lot of complications later down the line. So what we're going to do, and I'm just going to use a Ziploc bag, because it's the best thing I have, and honestly, gets the job done really well. You're gonna take any piece of plastic. So, you know, the wrapper from your gauze, from your sterile gauze, the plastic part, perfect. You know, any bags, any sort of, usually the packaging materials for other medical supplies is the best thing to use, in my opinion. Or if you do have one of the really fancy ones, those are great. And then some sort of tape. Obviously, if you have it, use medical tape, because that's the stickiest and that's going to stick to people the best. Duct tape also works great. I'm using masking tape. It probably wouldn't work very well if it was on skin and bloody skin, but for this demonstration, it'll work. So what you're going to do is you're going to start by firmly taping down all the sides. Or, you know, 2 of the sides. So you're gonna tape down 2 of the sides completely. Make sure they're down there super firm. Do a couple extra layers of tape on each side, making sure that it's super on there. And then what I'm gonna do And what you should do next is you're going to tape just like 3/4 of the way down this bottom side. So just about there. And then tape down the rest. And then you're gonna do the same thing to the other side. Just tape like 75% of the way. Just like that. Because what you've now done is when they breathe in, it's going to pull the piece of plastic flat against that wound, flat against the sucking chest wound. But then when they breathe out, it puffs up enough that air can escape just through this tiny little valve that you made, right over here. But when they breathe in, the force is gonna keep any air from getting past here, or not very much air. And also any blood that gets in there can make its way out, and it stays nice and clean and airtight. So, once again, some sort of flat plastic, tape 2 of the sides completely, and the other 2 just like 3/4 of the way. And more tape the better. So if this was on an actual patient, I'd be doing a couple more rows of tape just to make sure that it is on. So there you go. That's how you do an occlusive dressing on a sucking chest wound. Hopefully that makes sense. It's one of those things that's a little hard to do when you like can't really completely see the injury and understand what it is. So, you know, if you're curious, definitely look online. There's videos of it being done on actual patients. I think sucking chest wounds are really cool, and pneumothoraxes thoraxes are really cool from like a medical perspective. Obviously not if you have one. So do some Googling. Okay, and then finally we're gonna go over really fast, because this is one that can't necessarily be demonstrated, or at least not with the materials and filming setup that I have at hand, which is currently my phone taped to a takeout box. So what we're gonna do is how to deal with eviscerations. So an evisceration is when any of your internal organs are now forcibly brought outside of your body. So typically it happens the most with your intestines and your gut. You'll get like one spot that breaches the abdominal wall and all the layers of tissue in there, and you know, some sort of force is enacted and just a little bit of your intestine just like pops out. Usually, you know, think of like movies where someone gets cut across the stomach, their entire intestines out. Not always. A lot of times it's just like one little like boop, one little loop, it just pops out. So don't push it back in. There are medical professionals who are trained and carefully, you know, putting it back into the body, but you know, we're not in a position where we can just blindly start shoving intestine back, and a good chance that you'll do a lot more harm in doing that. So what you just want to do is cover it. That's the best thing. In fact, eviscerations tend to be big, like distracting injuries. So you run up to a patient who's been in this like really terrible car crash, and you see that a chunk of their guts popping out. I can guarantee that that is not the most time-sensitive injury on them. So, you know, the last thing you want to do is immediately run and start wrapping everything up, and then you go and check the rest of them out and you find out that they have this huge arterial bleed on their arm and they've been bleeding out for the last 45 seconds because you've been wrapping this evisceration on their stomach. Obviously, it's an important injury that you do need to address, but it's very rarely your first priority. So, what you're going to want to use is one of these. Just realized everything I'm doing is upside down. So you're going to want to use the biggest trauma dressing you can find. These things are super bulky, super thick. They're like of a really dense gauze, so they're super absorbent, and these are the best things. So what you're going to want to do, and I'm not going to take this out of the wrapper because we have very few of these, but I will walk you through it, is you're going to obviously open it and you're going to take it out. And what you want to do with any evisceration, anytime that you're dealing with an exposed internal part of the body, so there's a bone sticking out of your leg, you know, you've just had a couple fingers cut off, is you want to keep the site damp. So you're gonna take this out and you're gonna wet it. If you have saline, you're working in a hospital setting or an ambulance setting, or you have a really nice first aid kit, you're just gonna start dumping saline on this gauze. You wanna get it as wet as possible. Obviously, if you're not in a situation where you don't have gauze, a wet towel, a wet t-shirt, once again, any sort of wet fabric will work. So you are going to get this as wet as possible, and you're gonna put this on the injury site. You're just say that their bit of gut is just kind of popping out, you're just gonna go center it in the gauze and just kind of carefully lay that on top. So now you have your wet gauze. Now what you're gonna do is you're gonna make an occlusive dressing, which you guys remember from the last one is anything that's air and water tight. So a lot of times the wrapper from the gauze is great if you're leaving it folded. Typically these are folded in half. Otherwise, saran wrap works. Just a bunch of different pieces of plastic taped together. You're gonna wanna then put the plastic on top, create an occlusive dressing. So say I was doing this at home, and once again, that pesky roommate manages to slice themselves open. They've got an evisceration. I'm gonna go grab a bunch of wet towels. I'm gonna pack it on top of where he's injured, and then I'm gonna go get saran wrap and just start saran wrapping around him. Because you wanna create a barrier that's going to keep moisture in, but is going to keep dirt and anything else gross out. And also keep everything in place. You wanna make sure that you're putting a little bit of pressure on. Because if they start to move, or they cough, or exert any muscle of any type, there's a chance that they could push more intestine out. So you want to create like a wet, sealed barrier that's going to just kind of hold everything in place while you move them and get them to the hospital. So you're going to do your wet dressing. You're going to do some sort of plastic, either the plastic from the packaging, if it fits, or saran wrap. And then you are going to do a gauze layer on top of that. Because once again, you're doing the gauze layer to just hold everything in place, keep it covered, keep it neat, absorb anything that may work its way out. So, I hope that makes sense. You know, if you have any questions, feel free to post them underneath. I'm trying to keep these pretty short, even though this one turned out being a lot longer than the last one. If you have any questions, post them. I'll answer them as best as I can. There's tons of information online on what to do with all three of those things: pressure bandages, eviscerations, and occlusive dressings. The fun thing about them, and the fun thing about anything trauma, is there's not necessarily like one right way to do them. You definitely have your chance to MacGyver things. So, you know, look at the materials that you have, act fast, act safely, keep these tips in mind. But, you know, if you don't necessarily wrap them the exact same way that I did, that's okay. I'm sure that there are a lot of other medical professionals who would do it a lot differently, but that's just how I was trained and how I like to do it. So do some research. It's a lot of fun. Trauma's always fun for us, not for the patient. And hopefully these tips answered some questions and you learned something from them. All right, guys. See you soon.